Good morning friends and welcome to NPTEL Anti-Doping course. I'm Professor Dobson Dominic and today we are going to look into World Anti-Doping Agency's group of drugs prohibited in competition only. This is the week 2 lecture 2 second lecture. In lecture 1 we looked into the complete list of banned drugs. In this lecture we are going to look into substances prohibited only during that particular competition. So what are these are the broad outline overview of substances prohibited in competition during the competitions. What are the exceptions given? When exceptions are given for that particular drug or method, then the athlete definitely has to get therapeutic use exemption. We'll look into that and we'll conclude with our recommendations. Overview of competition prohibited substances. Substances which are banned only during competition periods. What are these categories? This category includes S6 stimulants, S7 narcotics, S8 cannabinoids and S9 glucocorticoids. Stimulants are mainly seen in cough and cold medications, which are commonly contain stimulants like sympathomimetic amines, especially ephedrine. So, these are commonly got by the athletes, especially in countries like India, where there is not adequate usage of proper medical prescription. Even pharmacists without a proper sports doctor's prescription can give this medications, especially the cold medications or hay fever medications. That is why it is very important athletes seek a proper sports medicine doctor's advice before taking any medications. The importance of sports medicine doctors in managing medications in athletes is very important. So if at all, if you have a state or a national or an international athlete who has even a simple fever or a cough and cold, please don't immediately go to a pharmacist and get the medications, because you need to know which cough cold medications doesn't have the banned substances. These medications should be avoided by athletes and athletes support staff. The next group of medications which are banned during competition are narcotics. Narcotics are prohibited in sports. Narcotics are derived from morphine and its chemical and pharmacological analogues. They are mainly pain relieving drugs and they affect the central nervous system. What are the examples of narcotics? Morphine, fentanyl, oxycodone. These are drugs which are predominantly given during emergencies and especially during operative procedures. They are mainly given for masking pain. The problem with misusing narcotics is there is a potential for leading to addiction and also a potential for leading to overdosage. So, definitely prohibited in competition, especially morphine, fentanyl and oxycodone. Narcotics are substances, as I told, acts on central nervous system for reducing the pain. The use of narcotics gives the injured athlete a sense of cure, and they can tend to ignore the pain, and that can subsequently lead to a potentially serious injury and risk further damage. So, if the athlete is suffering from a simple pain or a simple non-significant simple tissue injury like a muscle injury, and then he also has a tendency to misuse narcotics, then the potential to ignore the pain and continue with the game and thereby landing up with a serious injury is much more. So hence narcotics are completely banned during competition. The next group of drugs which are banned during competition are cannabinoids. What are cannabinoids? Cannabinoids are substances derived from cannabis plants, or they are also derived from synthetic equivalents. What are the example of cannabinoids? Example, hashish, marjuna. What is its mechanism of action? It acts by relaxation, and what happens is the athlete is so relaxed that he might lose a sense of coordination and balance, and thereby cannabinoids are prohibited in competitions. The specific substance of abuse in this section, especially 2025 WADA has included tetrahydrocannabinoid also in a group of prohibited substance during competition because of legal and health concerns. Prolonged use of cannabinoids may result in athletes losing motivation, decreased concentration, impaired memory and learning disability. Respiratory diseases such as lung cancer, throat cancer and chronic bronchitis are also side effects of cannabinoids. The next group of drugs which are banned in competition are glucocorticoids. Glucocorticoids are mainly medically used as anti-inflammatory and immunosuppressive drugs. So, inflammation is very common in athletes also due to the increased exercise training. The common glucocorticoids which are misused are prednisone and dexamethasone. This reduces inflammation, but if it is misused over a period of time, then the athlete's immune system is compromised and his immunity is weakened, and hence glucocorticoids are banned during competition. Glucocorticoids are taken in several routes, either through oral tablets, intramuscular injections, local injections including periarticular, intraarticular, that is inside the joint or around the joint, peritendinosus, that is inside the tendon, and intratendinosus, or peritendinosus is around the tendon and intratendinosus is inside the tendon. So, there are several ways glucocorticoids are given, and glucocorticoids has a washout period, that is ranging from 3 days for oral administration all the way to 10 days for intramuscular, intraarticular or tendinous injections. So, this is very important to note so that the testing agencies knows when the glucocorticoids was administered. So, remember, glucocorticoids are banned only during competitions. They might be actually indicated and they can be given pre-competition or post-competition. The next group of drugs which are banned particularly in certain sports, prohibited in particular sports, are beta-2 agonists. These are predominantly drugs which are given for asthmatic patients, chronic asthma patients, uncontrolled asthma patients. Even athletes are suffering from asthma. The most famous athlete I can remember is the current Olympic 100-meter champion Noah Lyles. Even he is a known asthmatic patient. So, beta-2 agonists, if taken into bloodstream, have anabolic effects or tissue building properties, and hence World Anti-Doping Agency has prohibited the use of beta-2 agonist by athletes, particularly during the sporting competition. So, during competition, beta-2 agonists are definitely banned and should not be used. If at all, if there is a clear therapeutic indication, then the athlete need to definitely apply for therapeutic use exemption, TUE certificate. Certain conditions, beta 2 agonist are given exceptions even during competition. What are they? Where are they? Inhaled salbutamol. Maximum you can give is 1600 microgram over 24 hours in divided doses, not to exceed 600 micrograms over 8 hours starting from any dose. This is where the importance, again, very, very important. Any athlete who is suffering from bronchial asthma seeks proper sports medicine advice, sports medicine doctor's advice, so that they can titrate the dosage properly pre competition, and even if the symptoms are persisting during the competition also, then the doctor can prescribe the dosage properly. The next is inhaled formoterol. Maximum delivered dose is 54 microgram over 24 hours. Inhaled salmeterol, very common, maximum is 200 microgram over 24 hours. And inhaled vilanterol, which is recently in 2024, there was WADA has given the maximum dosage up to 25 micrograms over 24 hours. So, this dosage cannot be supradosed. Suppose vilanterol is given for more than 25 micrograms, then again that constitutes anti-doping violations. Okay. So, if at all an athlete is going to take inhaled salbutamol or formoterol or salmeterol or vilanterol, therapeutic use exemption certificate is very mandatory, and that has to be kept in mind. So, these are the group of drugs which are banned during competition. What are they? Revise: stimulants, glucocorticoids, cannabinoids, and beta 2 agonist, beta blockers are banned during particular sports. These are the references. WADA site has all these latest references. Thank you for listening, and Jai Hind.